I am Gopinath, a mechanical engineer, retired. I came for treatment in this hospital, Narayana Hridayalaya. We were referred to here to meet Dr. Srikanth. ಶ್ರೀಕಾಂತ್ ಹತ್ರ ಬಂದ ಮೇಲೆ ಅವರು ಡಾಕ್ಟರ್ ರಘು ಅವ್ರಿಗೆ ರೆಫರ್ ಮಾಡಿದ್ರು, ಹಿಸ್ ಕೊಲೀಗ್, and then they decided on a procedure what is to be done on me. My basic complaint was breathlessness when I used to walk, and then I had to rest compulsorily. Then I would walk further after a rest of 5 minutes, 1.5 kilometers easily. With this symptom, they said that they would do TABG, and then there was a valve problem, aorta valve problem, to be replaced. But before the surgery took place, we met Dr. Devi Prasad Shetty on this same subject. He explained us another method to overcome my problem completely: loss of blood, recovering time, everything. Considering everything, they decided to do one TAVI procedure and then bypass surgery using robots. Though the difference was slightly higher, we took the advantages into consideration. We readily agreed and we went through the operation. In the last 1 week, I finished both the operations, TAVI procedure and bypass using robot surgery. I have recovered in less than 3 days. This hybrid procedure can be carried out on many other patients suffering from this kind of disorder.